see me now? Okay.
Yeah, we can see you. Thank you very much for joining us today, Dr. Xiaoli. So I'm going to introduce you today. She's an oncologist. So Dr. Lim Xiaoli is a senior consultant medical oncologist with OncoCare Center, Cancer Center. Her clinical expertise includes treatments of gynecological cancer, such as cancer of the ovary, uterus, cervix, and the vulva. Dr. Lim graduated with honors from Monash University Medical School, Australia, 1996. She received her medical oncology specialty training in UK and trained under several renowned oncologists, including Prof. Hani Gabra, a world-renowned expert on ovarian cancer. She obtained her certification in medical oncology from United Kingdom Postgrad Medical Education Training Board in 2008. She was the chairperson for Singapore Cancer Network Gynecological Cancer Work Group, which developed the first national consensus guidelines on treatment of ovarian and uterine cancers. She also teaches at the Duke NUS and National University Medical School. She was the KK Hospital Program Director for the Medical Oncology Residency Training Program in Gynecological Cancer for Oncology Training from National Cancer Center and Tan Tock Seng Hospital. Prior to joining OncoCare, Dr. Lim was a senior consultant medical oncologist at the Department of Gynecological Oncology at KK Hospital and Children's Hospital, adjunct professor at Duke NUS Medical School, and visiting consultant at National Cancer Care. So she's fluent in both English and Mandarin. Today she'll be doing the session in English. She looks very young for her age, so let's put our hands together and welcome Dr. Sheow. Can we mute everybody, please? And can we mute everyone? Unmute yourself.
Okay.
Okay, good.
Yep.
All yours. All yours.
Okay, thank you very much. Thank you very much, Vanka, for the invitation to attend this webinar. And thank you both for the very, very kind introduction. Now, I'm Sheow Lim. I'm a chemotherapy doctor. Okay, I specialize in the treatment of women's cancer. All right, and I'm a part of the group practice in the private sector now. And we have actually 12 cancer specialists in our group practice that provides very comprehensive management of cancers that ranges from services such as cancer screening, cancer diagnosis, as well as cancer treatment. So today I'm going to talk about cancer. Cancer is common, very unfortunately. Okay, it's a disease that is actually striking fear in the hearts of many of us. Okay, and as the saying goes, prevention is always better. So today's talk is going to center on cancer prevention. Okay, and I'm also going to talk about some of the red flags or warning signs of cancer. This is particularly important in this current climate where many of us are trying to avoid going to the hospital to see a doctor for fear of catching the virus. So when is a good time and when is a time that we need to go and see a doctor if we suspect cancer? Okay. Vanka, can I share my slides now?
Yes, please. Yes, please.
Okay.
All yours.
Okay. Can you see the slides?
Yes, I can see the slides.
Okay, can. So without further ado, let's get started. So how common is cancer? Singaporeans have got 1 in 4 chance of being diagnosed with cancer in his or her lifetime. So that's how common cancer is. It's the #1 killer in Singapore. 1 in 3 deaths are caused by cancer. Every year, approximately 15,000 Singaporeans, or just under 15,000 Singaporeans, will be diagnosed with cancer. Okay. Right, so these are tables showing the common cancers that is affecting Singapore men and women. So on top of the list for men are #1, colon cancer, #2, lung cancer, #3, prostate cancer. For women, it's breast cancer, colon cancer, lung cancer. Some of the cancers are getting more and more common and more prevalent, such as cancers of the breast, colon cancers, and cancers of the womb. Okay, the reasons for that are perhaps largely due to our lifestyle, our modern lifestyle that actually is more sedentary. We're getting fatter, obesity is a rising problem. All this has been shown to increase the risk of these cancers. Okay. However, over the last 30 years, we're actually getting a lot better, all right, in terms of cancer survival. So back in the 1970s, okay, a man who was diagnosed with cancer only has a 1 in 10 chance of surviving, all right? For women, it's a 1 in 3 chance of surviving. So fast forward to 30 years later to 2015, out of 2 cancer patients, 1 of them will survive the cancer. So we're getting quite a bit better. This improvement in cancer survival, we think, okay, is largely due to the fact that we can actually pick up cancers a lot earlier these days, okay? Number 1, because of screening. Number 2, because of the fact that I think there's more public awareness about cancer. Okay? We're also getting quite a lot better in the way we treat cancer, and we're getting better treatment outcomes nowadays. Okay, so what is cancer? Okay, cancer is a very complex disease, okay, that's characterized by the ability of the cells to grow in an uncontrollable way. Okay, so if you look at the screen here of the gene, okay, this is our cell that contains gene, which contains instructions, okay, to direct us how the cell can actually grow in a very normal way. Okay, this growth of our cell and the division of the cell is in a very ordered and controlled manner. Okay, however, during the cell growth, there are times whereby the gene gets damaged. This is what we call mutation. All right. Our body is able to recognize this damage and repair it, and the cell will survive. Okay. If, however, the damage gets very severe, it's beyond repair, okay, our body will get rid of the cell. So this cell will die. There will then be new cells that are produced by our body to replace the ones who die off. And this is actually a very natural type of renewal process. Under certain circumstances, for example, when there are damage to the genes, for example, genes that control the growth of the cell, okay, when this happens, what is possible is the fact that this control of the cell growth gets disrupted, okay, and the cell runs amok, okay, it starts growing very quickly, okay, when it's time for it to die, it doesn't die, okay, this is when cancer forms. Okay, so besides that, okay, cancer cells are not very respectful of boundaries, okay. They are very territorial, they can grow and they can go and invade the surrounding organs and resulting in damage to the organs around it. It may also spread to more distant organs. So for example, this is a colon cancer, okay, it can spread to the liver either via the lymphatic system or through the bloodstream. Okay. What causes gene mutations? As we said, by Joseph earlier on, as we grow older, our organs are not the same anymore. Okay, they don't function as well. Okay, our eyesight is not as good. Okay, our muscles are not as strong. Okay, our hearing not as good. So the same thing happens in terms of how our body copes with repairing the damaged gene in our body. Okay, as one gets older, the repair mechanism is not as effective. Okay, so there's a higher chance that this gene damage or gene mutations can occur, and therefore there's a high likely chance that you can get cancer. In fact, old age or growing older is one of the largest risk factors for cancer. Okay, other than that, we can also inherit this gene or this bad gene from our parents. This is what we call the hereditary cancers. Okay, we can also acquire these gene mutations from external sources such as from smoking, okay, from radiation, from chemicals, from viruses. For example, the HPV virus can cause cervical cancer. Okay, so can I make sure that I don't get cancer? Okay, there are some risk factors, unfortunately, that we do not have a lot of control over. For example, growing older. Number 2, okay, we cannot choose who our parents are and what are genes that we inherit from them. Okay, however, there are things that we can do to reduce our cancer risk, such as by adopting a healthier lifestyle, and also to go for cancer screening that can pick up early cancers or pick up pre-cancers. Okay, so what are some of the lifestyle factors or some of the healthy lifestyle we can adopt? Number 1, do not smoke. Smoking or tobacco smoke contains 40 cancer-causing substances, what we call carcinogens. So the type of cancers that's associated with smoking include cancers such as the cancers in the mouth, cancer in the lungs. So these are not just cancers that we can actually, the smoke when you inhale comes into direct contact with, but the smoke that is inhaled can also be absorbed in the bloodstream and travel to other parts of the body can affect organs such as the bladder, the kidneys, as well as the cervix. Okay, so it can increase many cancers. Okay, avoid excessive alcohol intake. Okay, this can actually increase the risk of liver cancer, mouth cancer, breast cancer, and colon cancer. Okay, many of us like a bit of a happy juice. Okay, the key to it is to drink in moderation. Okay, by that we mean that for women, to limit yourself to just one standard drink a day. All right, and for men, 2 standard drinks a day, and try not to exceed it. The number 3 risk factors is obesity, and this is becoming more and more of a problem, especially in many developed countries that's very affluent. Okay, partly because of our diet, partly because of the fact that we are more sedentary. Okay, we tend to move around a lot less. Okay, obesity, okay, can increase what's called the insulin level in our body. The normal function of the insulin is to reduce or control the sugar level in our body. But in people who are obese, they tend to have a higher insulin level. Okay, this insulin level has been shown in studies to actually make cancer cells grow, okay, and grow faster. Okay, the second reason is that the fat cells in our body can in fact be converted to a female hormone called the estrogen. Okay, right? This female estrogen, when there's excessive amounts of it, can actually promote the growth of certain cancers, such as breast cancer and womb cancer. An obese lady has got a 4 times increased risk of getting womb cancer compared to somebody who is of normal weight. Okay, so obesity is linked to breast, womb, and colon cancer. Okay, diet also plays a very important role. Okay, food is a very important part of our Asian culture. Okay, many of us perhaps live to eat. Okay, but it doesn't mean that healthy food doesn't taste good. Okay, so this top diagram is what is called a healthy plate. Okay, by the Singapore Health Promotion Board, providing us quite a very visual picture of what we should be putting on our plate. Okay, certain foods that we have to eat less are, for example, preserved food, processed meat. So things like salted vegetables, salted eggs, salted fish. Okay, processed meat such as bacon, ham, sausages. Because this food, the preservatives in this food actually can increase the risk of getting certain cancers such as stomach cancers and nose cancer. Food that's high in fat, okay, and red meat also increase the chance of getting colon cancer, okay, which is one of the most common cancers among Singaporeans. Okay? Instead, we should be eating more of fruits and vegetables. Okay, so fruits and vegetables are rich in fibers, vitamins, minerals, antioxidants. Okay, antioxidants has been shown in studies, okay, to enable our damaged cells in the body to regenerate and recover, and therefore reduce a chance of getting cancer. Okay, so other than the factors that we talked about earlier on, like do not smoke, maintain healthy weight, limit alcohol intake, healthy diet, physical activity. All this not only reduce our risk of getting cancer, but it also reduce our risk of getting other type of illnesses such as diabetes, high blood pressure, heart problems, and stroke. In addition, we should avoid too much excessive sun, as this increases our risk of getting skin cancers. There are also vaccines available against certain viruses, such as hepatitis B, okay, that can reduce our chance of getting liver cancer, which is the 4th most common cancer in men. Okay, there's also vaccine against the HPV virus, okay, that protects us against cervical cancer that we'll talk about in more details a bit later on. For women, having more children has been shown to reduce the risk of getting breast cancer, womb cancer, and ovary cancer. Okay, I think our government will be very interested to know this, okay, to actually encourage women, perhaps our women in Singapore, to have more children. Okay, in doing all this, okay, we can in fact prevent 4 out of 10 cancers. We are unable to prevent all cancers, but we can prevent 4 out of 10 cancers, which is not too bad. Okay, so this is a study looking at stress. Okay, this is a study that was done in late last year before the COVID pandemic. Okay, and it found a whopping 92% of working Singaporeans are stressed. I think it is something that many working Singaporeans can relate to. Okay, being constantly being need to be contactable through your emails, through your handphone, etc., etc. That itself can actually be quite stressful. Okay, post-COVID-19, okay, what we're thinking about is the fact that we will not be surprised if the stress level of our Singaporeans actually goes up. Number one, fear of getting infected with the virus. Number two, what's going to happen and the social consequences of this COVID. Okay, is it going to affect my job? Will I still have a job, in a month's time? Okay, how is it going to affect my businesses, etc., etc. So it's a I think pretty high chance that stress level is going to go up over this this very unprecedented time. Many a times in my clinic, when I see patients who have been newly diagnosed with cancer, they come and tell me, doctor, I think the reason why I'm getting cancer is because of stress, because I have got a bad husband, and who is causing me a lot of stress and anxiety and angst, and that's why I'm getting cancer. Okay, and there's some patients who tells me that, the reason my cancer comes back is because of the fact of the stresses from my work, stresses from my home situation, etc., etc. But stress actually cause cancer. Okay, so in times of stress, okay, for example, in a dangerous situation, our body will release what we call stress hormones. Okay, these hormones increase our blood pressure, increases our heart rate, make our eyes dilate so that you can see clearer, to prepare us for fight. Okay, to fight the danger or to run away from the danger. These are what we call stress hormones. Okay. There have been studies looking at mice, okay, which have been under chronic stress. And interestingly, in these studies, what they do is the fact that they put the mice in isolation. It's about like us at the moment going into social isolation during the COVID virus period. Okay, and they found that during this period of chronic stress, the cancers in these mice are more likely to grow and spread compared to the mice who are not under chronic stress. Okay, they also find that in mice who has a higher level of stress hormones, these cancers can actually grow faster and spread faster. Now, the relationship or the link between stress and cancer in humans, understandably, is a bit more difficult to establish, okay? Or direct relationship is difficult to establish. But nevertheless, okay, if you think about it, when somebody is stressed, okay, there is a higher chance that they may actually then take up more unhealthy behaviors to try to relieve their stress. For example, they may resort to smoking, binge drinking. They may need to, have an unhealthy diet, and for example, and make them exercise less, okay, and put on weight. And all these are, in fact, risk factors for cancer. In cancer patients who already has a diagnosis of cancers, stress is quite common, okay, and it's quite understandable, okay. And studies have shown that stress in cancer patients will actually result in a poorer quality of life because they are more likely to get depressed, they are more likely to get anxious, okay. In addition, okay, they also have a poorer outcome from their treatment. Okay, there may be several reasons from it, and one of the reasons is possibly because of the fact that these patients may perhaps be more likely to give up on their treatment because of their lowered mood, etc. Okay, so stress is not good. Okay, and it's important for us to be able to recognize that we are stressed and to deal with our stress. Okay, moving on, I'm going to talk about cancer screening. Cancer screening aims to pick up cancer before symptoms happen, okay? Because by the time symptoms happen, okay, the cancer may well be already in a more advanced stage and more difficult to treat, okay? So cancer screening are tests that we do to pick up cancers in well patients, okay? So it pick out lesions before it becomes cancers or cancers that are early. So which means that it has got a better chance of curing it with treatment. Screening for cervical cancer, breast cancer, and colon cancer has been shown to save lives. Okay. Colon cancer is the most common cancer in Singapore. In Singapore, with the highest incidence of colon cancer, one of the highest in the world, okay, especially in male Chinese Singaporeans, so need to be aware. Okay. There is what is called a precancerous phase in the form of a polyp or a growth, okay, that may take 5 to 10 years to slowly grow to become a cancer. Okay, the recommended age for screening starts at the age 50. Okay, these are the screening tests available for colon cancer. Okay, and each has its own pros and its cons. So there's no one single test. Okay, that is the best. They all have their pros and cons. Start off with, we have the fecal occult stool. The fecal occult stool is a stool test that detects any bleeding from the colon cancer in the stool. Okay, the advantage of doing such a test, because it's simple to do, it is cheap, okay, it's not an invasive test. However, it is not a very accurate test. It can miss cancer. It missed one cancer out of two cancers. Okay, which means that to do this test, we have to do it more frequently, once a year, so that we can reduce our chance of missing the pickup of a cancer. Okay, if the stool test comes back positive, blood is detected in the stool, you still need to go for a colonoscopy to look for polyps or cancer. Okay, so the colonoscopy, okay, is a test that actually puts a tube attached to a camera up the back passage into the large intestines to have a good look at intestines. Okay, it allows a direct view of the intestines, and therefore, amongst all the 3 tests, this is the most accurate test. Okay, because you can actually directly see the intestines to look for any growth and polyps or cancer. Okay, the downside of this test, number 1, it is actually invasive. Okay, and there's a small risk of damage to the intestines or perforation, and it is the most expensive of the 3 tests. Okay, but if this test comes back as negative, okay, you only need to do it once every 10 years. Okay, the third test is what is called a CT colonography. Now, this is a CT scan dedicated to looking at the colon. Okay, so it is not as accurate as a colonoscopy, but it's less invasive. Okay, if there is an abnormality found on the scan, still need a colonoscopy. Okay, next we go to breast cancer screening. I won't spend too much time because I think many of us are very familiar with it. Okay, we need to start examining our breast for women starting at the age of 20 and do it on a monthly basis. By the time we get to 40, it's advisable we go for mammogram or x-rays of the breast because it can pick up smaller lumps that our hand cannot pick up. Okay, cervical cancer, highly preventable cancer. Majority of the time, okay, or almost all cancers are caused by this human papillomavirus. So if we can vaccinate ourselves against this virus, we can significantly reduce our risk of getting cervical cancer. Age of vaccination between 9 to 26. Okay, there's a new study showing that perhaps even women above the age of 26, between 26 and 45, they may also benefit from this vaccine. If you're interested, you may need to speak to your doctor about getting a vaccine at that age. Okay. Besides vaccination, we need to do pap smear screening starting from the age of 25. There's also a new test called the HPV testing, which is in fact more accurate than the pap smear. And both tests can be done in the same setting. Okay, next I'm going to move on to tumor markers. Okay, these are blood tests detect proteins that are produced by cancers. So many of us who go for health screening may actually be quite familiar with some of this test. For example, a CEA blood test that can be produced by colon cancer. Okay, however, you need to be cautious about this test because number 1, they are not very accurate. Abnormal blood test doesn't mean that this is cancer. Okay, because non-cancerous conditions can also cause this. But if the blood test comes back showing abnormal, the doctor may order more tests to look for the cancer. Okay, likewise, if the test comes back normal, it does not mean the person does not have cancer. Okay, and this sometimes a normal blood test. The danger of it is the fact that it may actually give a false sense of security. I have actually patients, with ovarian cancer who's been diagnosed and tell me that, no, how is it possible that I've got ovarian cancer? I just had a CA125, which is a cancer marker, by the way, for ovarian cancer, done a few months ago. That's normal. Okay, so the important thing to remember is the fact that a normal cancer marker doesn't exclude cancer, especially if you are not well and you have symptoms suggestive of cancer. That still needs to be checked out. Okay, for smokers, they are at risk of getting lung cancer. Okay, they may consider going for a CT scan of the chest. This uses low-dose CT scan. Okay, the downside of this test is the fact that low-dose radiation is involved, and if you do it too frequently, okay, there may be a small risk of increasing the chance of getting cancers. Very briefly, I'm going to talk about cancer treatments. Okay, if a cancer is an early cancer, it is limited to one area. The main treatment is surgery. You chop out the cancer. Okay, for many of the instances when the cancer is early, surgery is all that the person needs. Okay, however, in certain cancers, even though it's early cancers, we may still recommend for the treatments to reduce the chance of the cancer coming back. This include treatments such as radiation treatment, which are high-dose X-ray treatment to kill cancer cells, or treatments such as chemotherapy. Okay, many people are very fearful when they hear about chemotherapy. However, many of the newer drugs nowadays actually have a lot less side effects, are better tolerated. We are better in managing all the side effects. Okay, besides chemotherapy, it's not just chemotherapy anymore. There are also newer cancer drugs who are actually very effective in managing cancers and treating cancers. And one such group is what we call the targeted cancer therapy. So the other name for this type of drug are designer drug or precision drug. Okay. In this day and age, we're able to analyze the cancer of the tumor to check for genetic mutation that is the driving factor for the cancer growth. We are able to detect this genetic factor mutation, then we may be able to find the right drug that specifically targets this genetic mutation and therefore to stop the cancer from growing. Okay, so these are called designer drugs. This type of drug, okay, is less likely to cause harm to normal healthy cells compared to chemotherapy. And in some cancers, it actually works very well. Okay. The next class of drug is a class of drug called immunotherapy. This is a very exciting form of very new cancer treatment. Okay, this is a type of treatment that many of our cancer doctors are very excited about. Okay, the way it works, it boosts immune system to be able to recognize cancer cells better and to attack the cancer cells. So it actually uses its own body immune system to go and fight cancer cells. Okay. Is been shown to be very effective in many cancers. And the most benefit that we're seeing is certain cancers such as lung cancers, melanomas, and other cancers as well. Okay, with all these newer treatments, what we are seeing is the fact that people, even when they have very advanced cancers or what we call stage 4 cancers, we're able to control the cancer, okay, make them live longer. Not only do we make them live longer, but we also make them live a lot better. Okay, so do not despair. If patients are diagnosed with advanced cancer, there's still good treatment available. Okay, I'm going to finish off. This is my last slide. Okay, is this cancer? So we use the mnemonics caution. Okay, a change in bowel habits, bladder habits, ulcer that does not heal, unusual bleeding such as noticing blood in the motion, or in a woman who is already after they have reached menopause, they notice blood through the vagina. Any lumps that shouldn't be there in our body, indigestion, difficulty swallowing, any obvious change in the wart or mole, okay, or a nagging cough or hoarseness that wouldn't go away, any unexplained weight loss or fatigue. Okay, symptoms that when you expect them to actually get better within the certain time period that does not get better is when you start worrying, is this cancer? So I'm going to end my talk here. I think I've gone over time. Sorry about that.
Thank you, Doctor. Thank you, Doctor. I'm going to ask you the questions. We're not going to do the poll because there are about 4 or 5 questions only.
Yes.
Would you be able to unshare your screen?
Okay, sure.
Or would you want to?
No, I can unshare, no problem.
Yeah. So the first question is, we'll do this very quickly.
Sure.
Is there any concern if the menstrual periods last more than 2 weeks for women above 55?
Above 55. Okay, so as you reach the age of 55, we need to find out a bit more about the menstrual history. Okay, as we grow older, the menstrual pattern will actually get perhaps a bit more irregular because as we reach menopause or perimenopausal. So I think it is something that you need to sit down and talk to the doctor, go through the menstrual history carefully, and perhaps go to see a doctor for the patient, a doctor to do a check on you, to examine you, plus and minus doing investigations if the doctor feels that there's a need to. Okay.
Is it compulsory to do pap smear test after giving birth? If yes, how often?
Okay, so pap smears is advisable and recommended in women who are sexually active above the age of 25. Okay, so it's not just after childbirth. Okay, so women above the age of 25 who are sexually active need to go for pap smear. The recommended frequency is every 1 to 3 yearly.
So how early should one do pap smear? 25 years old, right?
25 years old.
Okay.
Yeah.
Do you have any guidance for drinking wine? How about any guidelines for eating comfort food, such as potato chips, ice cream, bubble tea, chocolates? Like not many, and how many times a week? Yeah.
At the end of the day, I believe life is about living. Okay, so there are little pleasures in our life that sometimes we can occasionally indulge in, but we shouldn't overindulge. So number one, in terms of alcohol, the recommendation is 1 standard drink for women a day. Don't exceed that. For men, 2 standard drinks. Okay. You can go on the net and have a look and see what 1 standard drink is. 1 standard drink usually means a can of beer, 30 ml of liquor, a glass of wine. Okay. All right. In terms of food, okay, for us, I think comfort food is what we reach out to in times of stress. Okay. So I think so long we don't overindulge, it probably is okay. All right. Don't have it every day. The occasional cheesecake, the occasional crisp, is probably all right.
If one has removed their womb, is it still necessary to do pap smear?
It depends on the indication of why the womb is removed. If the womb is removed for non-cancerous condition, the answer is no. But if the womb is removed for cancerous condition, yes, we still will encourage pap smears, because sometimes pap smears may pick up cancer that has recurred in the vaginal area.
Okay. I'll just do one last question.
Yes.
You mentioned the preferred test besides you mentioned that a preferred test would be pap smear. Is there something more superior than that?
Yes, actually it's pap smear, and now there's a new test called the HPV testing. All right, this is a new test. It's more for women after the age of 30, and it can be done in the same setting when you do a pap smear. So you can do both tests at the same time. So it's actually more accurate than pap smear, because it actually tells you whether or not you actually has been infected with the high risk, what we call the high risk type of HPV virus. Okay, pap smear is just looking and see whether there's any abnormal cells, and sometimes the accuracy is not as good.
Okay. Thank you very much, Dr. Sheow. Do you want to say anything else as a final passing words to all our attendees today?
Well, I think number one, we all need to stay safe, stay healthy. Okay. There are things we can do to reduce our chance of getting cancers through healthy lifestyle, to go through screening. But even with patients who have been diagnosed with cancers, with early cancers, no, do not despair, because there are good treatments and it's a good chance we can cure your cancer. Even with people, okay, where the cancer is already quite advanced, okay, or the cancer has come back, there are good treatments for it, okay, that can actually control your cancers and make you live longer and live better. So don't give up.
Okay. Thank you very much, Sheow. Can I get Kiki to unmute everybody so that we can give a round of applause? Thank you.